Welcome to Raise the Line with Osmosis.org, seeking solutions with leading experts on how to increase healthcare capacity so people can get the care they need during the COVID-19 crisis and beyond.
Hi, I'm Shiv Gaglani. It's fair to say that appreciation for frontline healthcare workers increased considerably during the pandemic. That's especially true of nurses who have worked tirelessly to confront the overwhelming challenge presented by COVID-19. That's why we're particularly honored to welcome today's guest, Elizabeth Iro, who's the Chief Nursing Officer for the World Health Organization. Before being appointed to that post in 2018, Ms. Iro served as the Health Secretary for the Cook Islands, the first nurse, midwife, or woman to hold that job. For the first 25 years of her career, she was a practicing nurse and midwife, serving in several roles in the Cook Islands and New Zealand. I'm looking forward to getting her unique perspective on the state of nursing now and in the future, and her assessment of the pandemic response. So, Ms. Iro, thanks so much for taking the time to be with us today.
My pleasure.
So I'd like to start by first learning more about you and what got you interested in a career in healthcare, and then specifically nursing and midwifery.
As you've mentioned in my bio, I come from the Cook Islands, little paradise in the Pacific Ocean. It is a self-governing island country in free association with New Zealand. That just basically means I'm a New Zealand citizen. And so for me, after college, I was deciding what to do. And of course, nursing was an option for me. So having received a government scholarship, it kind of opened the opportunity as well. I saw it first as it was an opportunity to travel. I heard stories about how nurses were traveling to different countries, seemed really exciting, for me from a small island state. At the same time, knowing that there was some security, in a job that you can basically work anywhere in the world with this qualification. So I set out to do my nursing training in New Zealand. I think I was only about 18 years old at the time, and then returned to the Cook Islands. And then not 2 years after that, realizing some of my limitations in my skill sets, I sought to return to New Zealand to do a midwifery training. On completion of my training, I was a sister in the surgical ward. And I think it was then when I realized, the motivation for nursing ran, a little bit deeper than the travel or the job inspiration I had, after college. So I was kind of determined to focus on making a difference to the lives of the people that I looked after and the people in the general community as a whole. There's this emotional connection with the people I cared for. And so for me, it's seeing and hearing, from people, the differences I made to them as patients or to their families' lives, the care that they received from me has been the motivation to remain in this profession. It's what continues to motivate me now, and even in this role. I've enjoyed working basically, more so in the field, in the clinical areas, and really having that real connection with the people and the lives that you make a difference to. And I think at the same time, I did appreciate, the respect I also got from my colleagues, from the doctors, from the other nurses, midwives, the cleaners within the hospital, and also the administrators. But I have to say that in my experience and responsibilities that I took on, there was this gravitation to take on more responsibilities. And so, you go from a clinical to a policy kind of lens in everything that you did, or everything that I did anyway. There was this kind of need to take on more responsibility, but that meant looking outside of the clinical space as well. So I just feel as I have migrated, in my roles, the different roles and responsibilities that I've taken, there's this transferable skills that you take along, you build and you take along to the next role as you kind of, either go sideways in your career or go upwards in your career. And I think that's been a key element, I feel, in the work that I do and what's kept my interest in this field. So, and as you mentioned, the various roles that I had played, and prior to actually coming to this role within the Ministry of Health in the Cook Islands, I did feel very privileged that I was able to do those things. But I think this is the thing about this career, I feel. This is what nursing allows you to grow into. The potential and the possibilities are really endless. You build the skills, the competencies, the knowledge base, and really it's about, where is the next opportunity? And I think that's how I kind of perhaps came into this role. Some of us don't always have the opportunity. We may have the talent, the competencies, but not many of us perhaps get that opportunity. So I think this is one opportunity that I've kind of opened up for me, and here I am.
Yeah, no, thanks for that bio, and it's pretty amazing career progression. And you said you like responsibility. I can't think of a career that requires more responsibility than joining the WHO a year or two before the global pandemic hits in the chief nursing officer role. Can you talk to us a bit about what it's been like working at the WHO and some of the major accomplishments that you're proud of over the past 2 years or so?
The timing was perhaps perfect. There was this real global movement to make nursing visible to everybody, from policymakers, from clinicians, from students. So you had the Nursing Now campaign that started in 2018. And so I think, there was engagement with not just nursing global communities, but I think, health professionals globally. And I think Dr. Tedros's appointment of me and his championing of nurses and midwives, I think were critical to the work, I suppose, that I ended up doing. Of course, then we had the International Year of the Nurse and the Midwife in 2020. And then we had the global pandemic in 2020. So I think all of that somehow still got the focus on nurses and midwives and what they do. COVID-19 definitely made that possible in terms of really understanding what nurses and midwives, the value to contributing to healthcare globally. And I think also in this time frame that I was here, we also launched the very first State of the World's Nursing Report. Up to that point, we hadn't had any real data on nurses, on numbers and where they are and where they're short and what they were doing. And so I think, that was one major piece of work with key partners, with ICN and Nursing Now, and of course led by WHO. So I think these were key things that somehow, in spite or despite the pandemic, that we were, nurses were able to kind of complete. And on top of that, we also had the third State of the World's Midwifery report. And all of this in the time of this global pandemic and, the challenges to really engage and work together on this, because I think it was really critical that we got the data to actually show what more we could do. And I think that's just been one of the big pieces. Those were perhaps some of the big major events or items that we were able to fulfill in the last couple of years. But I think there were also some events that we had to either postpone, and also some that we took to a virtual platform. We had our first global government chief nursing and midwifery officers meeting, and meeting of nursing leaders from our nursing associations and our midwifery associations and our regulators held virtually. So it was quite an experience, and we saw, a huge participation in that forum, and where again the State of the World's Nursing Report was the findings were discussed, where government chief nurses and nursing leaders globally were able to say, these are the priorities we want to take forward. So really laying in the foundation for WHO to carve policy options in those areas. And so I think, as a result of all of those reports that were done, we were able to present this to the World Health Assembly just this May, and had a resolution on strengthening nursing and midwifery endorsed by member states. So we have something really solid to help us go beyond COVID. I think, for the next 5 years, we have some real solid policy options that we can take and support countries to make a difference. At the end of the day, it is about what countries can do. understanding the overwhelming situation they're already in at the moment. So how far we can actually support them and how much, I think that's just a work in progress.
Totally. And speaking of supporting countries, I mean, you hail from Cook Islands and are a New Zealand citizen. Clearly, New Zealand is one of the shining stars in how they've approached the pandemic, and there's been a lot of praise for your prime minister. What are some of the countries, in your opinion, that are doing the best for their nurses and midwives, whether it's letting them practice to the full scope of their license, helping address burnout, forming enough new nursing schools and training programs so that the workforce is rejuvenated? What are some of the examples, any specific examples of countries that have done a good job in policies that may have been adopted by one country that other countries should consider?
Interesting you say this, because it kind of depends how much government chief nurse actually have a say in the planning and the decision making in their countries. And then we've also got some who are very well matured in their health systems and have given real direct responsibilities around COVID response and vaccine rollouts. So I think that's been something we're quite keen to address and share those stories. I think for me, some of the key ones right now is the government chief nurse in Israel, who's been really a part of the decision-making in their response to COVID-19. At the same time, also with the vaccine rollout. I mean, she's been very key to their program around the vaccine rollout. In Australia, we've had the chief nursing officer, who's also been a key, or actually the face for them for COVID-19 in terms of the response and what she has done in terms of anticipating the next surge and capacitating her nurses to enable them to, move into intensive care unit mode as the situation arose. And of course, we're seeing that. So I think that's for me is something really quite important that should be shared. I think in terms of the mental health support, we've had cases where basic psychosocial support, online learning is becoming a thing that's been shared. We've had our colleagues from various collaborating centres, actually making this happen for nurses. I think we've really managed to make this a virtual approach to supporting our colleagues globally. That's just been something fantastic that I've seen as a result. It's not just one country, it's actually a collaboration of the nursing and midwifery community. That's just some of the ones I can share with you just right now.
Those are wonderful. And on that last point about mental health and resilience, obviously there's systemic improvements that need to be made for the health systems. One of the things I'm most proud of from even this podcast is we had Ariana Huffington on a couple of months back, and with her organization Thrive Global, we made a continuing education course on nursing resilience that we've distributed to our audience, which I'd love to share with you after this at some point. Regarding global health, obviously you're in a prime position at the WHO to talk about this. We're talking just a couple of days after the US said that now they're recommending booster shots, and Israel has been doing this for people over 60. It's obviously caused a bit of a global outcry because somebody at the WHO compared it to giving an extra life jacket to those who already have a life jacket versus 3.6 billion or more people who have not even gotten their first shot. We've had people like Ashish Jha and Chelsea Clinton on who've talked a bit about vaccine equity, but you're probably the best positioned, given your role at WHO, to just weigh in on the debate. What are your thoughts and WHO's thoughts on how best to move forward here?
Well, I think I'm not going to differ too much from what you've heard already in terms of WHO position around vaccine inequity. That for me is when I see my colleagues in other countries and I'm not even hitting 2% coverage, it's really quite disheartening, because we know that if we don't address this in every country, it's not going to go away. So I think, we're keeping to that principle, that we actually ensure that globally in every country, we are being equitable in our approach to support them to address and mitigate the circumstances that we're in at the moment. There are issues around vaccine hesitancy. We're also interested in, should vaccine be mandatory for all healthcare workers. I mean, these are conversations I think that nurses everywhere are really quite keen to get in on that debate, and they should. From a WHO perspective, we will continue to kind of say, please do encourage everyone to take the basic principles that WHO has been promoting around masking, around physical distancing, around good hygiene practices, and of course, vaccination. That is also the message I will continue to encourage my colleagues and everyone to take on board.
Yeah, it's remarkable to see, again, how different countries have different problems based on socioeconomic status, the amount of misinformation, conspiracy theories, political situations, and other things. The second question is, imagine you're speaking to a young Elizabeth Iro about just starting the career on whether to pursue a career in nursing or midwifery. What advice would you give to her and the millions of other potential nurses and midwives about approaching their career in nursing, especially given now that we've had a pandemic and some people I know are diving in because they want to be on the front lines helping people. Others may be a little concerned about what they're hearing about burnout and other things. We've had tens of thousands of frontline healthcare workers die in the last year and a half because of COVID, as an example.
I think from the outset, I want to say that I'm really proud of the global response from nurses and healthcare workers to this pandemic. They really have stepped into a situation that is high risk, that's unknown, unprepared, and under-resourced in some areas, but they continue to care in the most difficult situation. And I recognize this has come at a huge personal cost to many in this profession. At the beginning of the pandemic, I think we saw the excellent response from the general public in regards to, how nurses were responding. But it really has tested all of us, tested our profession across the world as a community, as a family member, and as individuals. I just really want to say that, despite this pandemic, the crisis recently in Afghanistan, in Haiti, the climate change impacts of flood, fire, all appear so overwhelming. But I think I just want everyone to remember to pause and breathe and focus on things that are around you and the people around you that matters to you. It can feel really lonely at times, but remember there are about 28 million of us out there, 28 million nurses. So I'd say latch on to good role models that inspire you and be kind to yourself and to each other.
That's wonderful advice. And speaking of role models, I know absolutely many of the people listening to this will already consider you to be one of those, or if they haven't yet been familiar with you, they will now. My last question is there anything else you would like to share with our audience? We have an audience of millions of current and future healthcare professional students. I know, anything you say, they're very interested to hear. So anything else I haven't asked you that you'd love to get across to them?
I'd like to say that I think one of the new initiatives that we're taking forward, because we've listened to country government chief nurses and government chief midwives who've told us that they want to get connected. They want to remain connected. And I think, this pandemic has really tested a lot of us. So we're building a new initiative, a global community of practice for nurses and midwives. We are starting off by onboarding government chief nurses and government chief midwives initially. And we anticipate in the new year a rollout to engage and hopefully onboard as many nurses and midwives to get connected and provide some inspirational kind of discussions that will be current, and really just to listen to them as to what do they want. So I think, I just want to highlight that at this moment, and we will be reaching out and making this a little bit more public and formal in the coming weeks.
I'll definitely take a look out for that. And if we can be helpful in spreading the word, we'd absolutely love to do that even beyond this podcast. So Ms. Iro, thanks so much for taking the time to be with us today. And more importantly, for the work that you and your colleagues do to raise the line and improve global healthcare capacity.
Thank you. Take care, everyone.
I'm Shiv Gaglani. Thank you to our audience for checking out today's show. And remember to do your part to flatten the curve and raise the line. We're all in this together. Take care.
For For more information on how you can help raise the line and flatten the curve, go to osmosis.org/COVID-19. If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our podcasts at osmosis.org/raisethelinepodcast.